everybody, to our online program from the Sunshine Coast Health Centre up here in Powell River, BC. And we've been talking about youth and addiction. And whenever we talk about youth and addiction, one of the key issues that comes to mind is, well, how do you prevent young people from succumbing to the addiction? So all sorts of programs are available, dozens of them actually. But there's this curious thing about all these drug prevention programs is, as far as I'm aware, there's no program that actually works very well. Now, a lot of the creators of these programs will say, oh yeah, they work great. But when the really competent researchers start looking at the data and start conducting the analysis, again, I'm completely unaware of any program that actually stands that kind of test. The most obvious example is the DARE program, of course, which we've been studying this for years and years and years with everybody's getting the same results, that it really doesn't seem to do very much. Although they've improved it over time, but the key thing is DARE, like a lot of the prevention programs, it has this message, and the basic message is for the young people, drugs are bad, so don't do them. And here's all the bad things that drugs can do to you. And if people offer you drugs, here's some things that you can do to resist using the drugs. Which is a really interesting approach because, again, as I mentioned, that I am unaware of any program that uses that approach that actually is effective. And we've talked last time about this idea that maybe what makes young people vulnerable to the addiction is really a lack of self-awareness. They really struggle to have a sense of who they are as people. Their goals seem to be more other people's goals, or maybe stuff they've seen on television, and they really don't have good relationships. And you can imagine, think about this, is this philosophy to tell someone who's like that, who finds energy and some vitality in intoxication, to tell them, well, drugs are bad, so don't do them. Sort of makes sense maybe why these drug programs don't work very well. Anyway, some of the research that has been coming out, a lot out of England and some out of the United States, is proposing that maybe we should change prevention programs. And rather than key on this message, drugs are bad, don't do drugs, maybe incorporate this idea that, young people do drugs for a reason. There's an attraction to them. And if we could incorporate that idea into a drug prevention program, who knows, maybe we'd get much better results. Anyway, things to think about. And that's it for this time on our online program. I'm back next time with our final topic on youth and addiction.